I will be showing the repair of a wide strip scar created by 2 strip surgeries, the second strip performed by me. A motorized programmable coal isolation device was used to harvest the FUE grafts. This 30-year-old Oriental male with a very elastic scalp had 2 strips taken from the same location in his early 20s. There were no known complications, and there was no significant reduction in scar width after the second surgery. A .075 millimeter diameter titanium tip punch on a Versi handle was used to make recipient sites. The size of the FUE punch was 1.05 millimeters in diameter. The angle of the punch for recipient sites is the same as the prevailing angle of native hair around the scar. The punch depth is that of the FUE grafts, on average 4 millimeters. I am avoiding existing hairs to prevent damage to them. There are often misdirected hairs surrounding the scar after strip excision surgeries. You can see the distorted angle of hairs at the top edge. You can also see a few hairs from the trichophytic closure in the center of the scar. If the skin is prone to stretch, or if there is too much tension on closure, the trichophytic closure is of no value. To ensure graft survival, it's very important not to make the holes too close, since there is less than normal blood supply in the scar. Therefore, more than one session is often necessary. Even spacing of the grafts mimics normal distribution after growth. The patient was switched to the prone position for placing after being in the sitting position for the creation of sites. Where the hair angles downwards, it is easier to place in the prone position. 4.5 magnification is used for all aspects of this surgery. 1 hair grafts are placed inferiorly, 2s in the middle, and 3 hair grafts superiorly in the scar. The grafts are grabbed gently at the base and with cotton-tipped applicator assistance spun to make the graft epidermis flush with the donor skin to get the necessary inferior angle. We don't trim the epidermis so the angle can be seen. The grafts were stored in Plasma-Lite A solution and held on ice coolers. The grafts were examined microscopically, minimally trimmed, and transections removed. There was a transection rate of 5%. Grafts larger than 3 hairs were made smaller. Strip scars are often wider on the left, as you see in this patient. Most surgeons are right-handed and suture right to left. The available laxity is used in the beginning, leaving less laxity, a tighter closure, and wider scar on the left. A total of 1,200 FUE grafts were extracted from the donor area inferior and lateral to the scar. 300 FUE grafts were placed into the scar and 900 in the hairline and frontal area. This is 8 days post-op, during which time the patient must be more careful than usual. Grafts are less secure in scar tissue and easy to dislodge. While not ideal to take grafts below the scar due to blood flow disruption, this patient requested all grafts be done in one session due to time constraints. I would have preferred to graft the scar at a separate session. Strip scar visibility limits donor hair length. The more grafts growing in the scar, the shorter the donor hair can be worn. If the patient wears the hair long enough to cover the strip scar, the FUE donor area will always be covered. I have no after photos of the prior patient. 2 sessions of grafts were placed into this patient's scar using a .75 millimeter punch and FUE grafts. Although the FUE scars seen inferiorly may appear to create a new problem, they don't. The benefit of the FUE scar pattern in the donor area is that hair remains between the scars. It looks futile to create additional scarring to hide a strip scar. The key is hair between the small round scars is preferable to a linear scar pattern with no hair. Placing hair in the scar mimics the FUE scarring pattern, which is more easily covered. Thank you. I will be showing the repair of a wide strip scar created by 2 strip surgeries, the second strip performed by me. A motorized programmable coal isolation device was used to harvest the FUE grafts.